Hi everyone, Dr. Brittany Bergeron. I'm here at the Chicago Midwinter meeting and I just ran into my celebrity friend, Dr. Yasuda Rainey. She is on this month's cover of Dental Product Shopper with a product that I'm not as familiar with and I know is new on the market. So I'm hoping you could tell us a little bit about this product.
I would never consider myself a celebrity, but thank you for that very warm introduction. It was a lot of fun for me to be able to do that project and be on the cover of Dental Product Shopper, but mostly it was because I'm excited about what ACTIVA is offering now, which is their new product is their BioACTIVE Bulk Flow. And I love composite. I love using composite wherever it is possible to do so, which just means that some of my preps are a little deeper, a little broader, a little wider. And so I really want to understand the chemistry of the materials that I'm using to make sure I'm prepping the tooth for the materials and they're using the right material for the job. So for this one specifically, it's a bulk flowable. So you can basically start at the bottom, fill the whole thing up. It is a dual cure, so it starts to set already when you're putting it in the base there. So you're not worried about anything having a void at the bottom and starting to set. It controls the viscosity of the spray. But it also is self-leveling. So as you're filling it up, it starts to kind of settle into where it needs to go. And again, some of these teeth that I'm restoring, it's kind of a little bit messy back there. And
Sure.
Being able to rely on the science in the material itself makes me feel really confident that we're going to get a good result. It also comes in a universal shade. And we all know that we've all opened a box, a drawer, and there's all this expired C4 composite and D2.
Guilty.
Right.
Absolutely
We've
guilty.
all done it.
We have done it.
This just takes that out of the equation. And so the combination of the remineralization support, the fact that it's a bulk fill material, the fact that it's a dual cure, the fact that it's universal shade. I use a clear matrix so I can always see where I'm curing what patterns does and those things all the time. It just makes me really happy that there's something out there that I can reliably give my patients the option to be using for their care.
Yeah. How did your team feel about using a product like this? Did you go from more of like a flowable syringe or a packable? Because, I know when I first started using this, the delivery system for the traditional ACTIVA is somewhat different. And I think conceptually as dentists, we have it in mind that this packaging is maybe only used for core buildup material or temp cement or something like that. So how was that integrating it to your practice?
I'm going to be really honest with you. The first time we did this, we took the plunger out and stuck it in there and got it stuck. So don't do that. This is much simpler. It doesn't have to be complicated. And I think that my team is always thinks that I'm complicated by having all this stuff.
Sure.
This is very easy. And once we realize we made a very grave error or a very simple mistake, it really is just as simple as finding the tips, bending the cannula. We can bend it in any direction we're going.
That's one of my favorite parts about this product line is the cannula tip. It does not matter, like you said, if you're working a deep prep, nobody loves to do number 2 distal occlusal pull. I mean, those areas are so hard to reach, but you don't actually have to be able to get your hand back there.
Right. And I have miniature fingers, so it's very easier to do that. But yes, it was not a complicated transition for our patients. We always do, caries risk assessment, and so we know if the patient has a moderate or high or extreme caries risk, and this is going to be something that we're going to reach for on the tray. My team knows that if we're not doing something, on tooth for 8 facial, then I'm going to want something like this.
Yeah, that makes a lot of sense. In my office, we are always looking for efficiency. So I'm curious, this being universal, maybe that will become our number 8 facial, maybe not for composite veneers, but certainly we see a lot of ruptures or caries after orthodontic treatment. Maybe that's a good opportunity for this product.
Okay, so I told you that how I used it and tried to jam it into the gun here. But how are you finding that you're using it in your practice?
So I think everyone knows I love the ACTIVA Restorative gun, so I'm fingers crossed we're going to get there. So I like efficiency. I don't like having to have a lot of products. I had issues with some of the other universal products on the market, trying to find shades for, our aging population, people that have, defects in their enamel that just have unique shades that aren't an A1 or a B2 or that becomes really challenging because they deserve aesthetic restorations just like everybody else. So, I've tried a lot of the other competing products and I didn't like the way that they handled And I didn't always feel that the color match was that great. There's a lot of grayness sometimes in translucency, and that's what I personally found that I really like about this product. And so I used it I have tried it in posterior teeth, endo access fills, things that you're trying to have a less obvious restoration. And I found it's done really well. But we've also started using it for a lot of our class 5s. I like the dental bonding of the products and the fact that
it works great in that class 5 area. The viscosity, it just kind of flows into those spots.
Yeah, it flows in those spots. These products are known for having like the tensile strength, the flexural strength, and all of that really matters in those areas, the parts of the teeth that are flexing, your bruxers or people that are in traumatic occlusion that won't go through ortho. So, my goal is always to set my patients up for success. And I find that using this product, it's really changed what I'm able to do in the anterior region while delivering the same results that people in my practice have come to expect as far as bioactivity. We talk about that with our hygienists, the remineralization support, all of that. We talk about fluoride treatments. And so our patients are really well educated. And so, when we work on the front teeth, they'll say, oh, well, is this going to be the same as what you did in my back tooth?
Yeah.
And up until
that's amazing.
Up until
the
that
doesn't happen overnight. That's really great that your whole team is on board with.
Taken time, but it helps our fluoride program. It helps our patients understand. It helps to build trust. I think that dentistry is tough, right? Patients know that you didn't hurt them and you were nice to them.
Absolutely.
And so I find that educating patients on the materials and using what, in my opinion, is a better material, something that's going to do good for our patients, makes a difference. So I'm just really happy to be able to now incorporate this more into my practice for patients who have those unique shades of teeth, because it is tough doing A1 through 3.
And also have the expectation that you're going to continue putting the same kind of materials that you've already done for them in the past moving forward.
Yeah, exactly. Well, thank you so much. I know that you're busy. You're talking to a lot of different people.
Thanks, media. I'm just so excited that you're here. We're both in the same place at the same time.
Well, these meetings can be crazy. You're taking courses and you're running into colleagues and you're trying to make connections. So as a longtime Halted fan and Activa fan, I was just so excited to be able to pick your brain. So thanks for taking the time. And
of course,
I know I'll see you soon.
I know.